Hello, everyone, and thank you for joining our call today. My name is Sydney Kneller, and I'm here with you to talk about promoting interoperability. With the complexity and dynamics posed by the recent Promoting Interoperability regulation, healthcare organizations may need assistance breaking down requirements and next steps for healthcare IT implementations. This presentation will serve as a guide to highlight the background of interoperability progress in the U.S. healthcare industry, program requirements, and project standards when it comes to this regulation. For our agenda today, we'll be reviewing the background of promoting interoperability, followed by the technology and requirements. Then we'll touch on implementation best practices, and we'll close out with a chance for Q&A at the end. So to get us started, let's first discuss what promoting interoperability actually is. This is healthcare regulation created by CMS that incentivizes hospitals and providers to utilize certified electronic health records in a meaningful way, including the exchange of health information and improvement upon quality of care and patient outcomes. Now let's take a moment to talk about the progression of promoting interoperability in the U.S. healthcare industry. In 2009, President Obama signed the American Recovery and Investment Act, which intended to stimulate the U.S. economy and allocate funds to various sectors, which included healthcare. As part of this act, the HITECH Act was released, which offered hospitals and health professionals incentives for HIPAA conformance and utilization of health information technology, more specifically EHRs. The HITECH Act also helped to fund the Meaningful Use Program, which is now known as Promoting Interoperability. This further incentivizes hospitals and providers to adopt Certified Electronic Health Record Technology, or CERT, and utilize this technology in a meaningful way. Adhering to promoting interoperability is important and certainly poses benefits for health systems and for providers. Patients and caregivers have increased access to their complete EHR information. Providers have access to patient health information at the right time and place to facilitate safer, better coordinated, and more efficient care. Payers can help with coordination through the electronic health information and can complete timely coverage decisions based on that real-time accurate data. And then researchers and innovators have access to current data to support groundbreaking studies and development of new applications and technologies that may be needed. The increased interoperability efforts also improve collaboration and communication across care providers throughout a patient's continuum of care, driving engagement in a meaningful way. These elements all work together to not only increase health system or provider reimbursements and decrease administrative burden, but ultimately improve patient care outcomes. Now let's explore what's needed to comply with promoting interoperability. First, I'll note that there are two different types of participants, including eligible hospitals and MIPS eligible clinicians. However, I'm just going to focus on eligible hospitals within the scope of this presentation. There are 6 required elements that each play a role in complying with promoting interoperability requirements that are listed out here. The first is that the EHR reporting period for both new and returning participants attesting is a minimum of 90 days. Additionally, to be considered a meaningful user, eligible hospitals are required to use certified electronic health record technology under the 2015 Cures update criteria. Participants are required to report on 4 scored objectives and measures, including electronic prescribing, health information exchange, provider-to-patient exchange, and public health and clinical data exchange. And in my written report, I'll be diving deeper into each of these sections and the aligned objectives, scorings, and products to accomplish these 4 elements, but we'll not be discussing them here just due to our time constraints today. Next, the points acquired throughout these categories must total to at least 60 points to satisfy the scoring requirement. Additionally, participants are required to report yes or no on the Protect Patient Health Information objective, including on the Security Risk Analysis measure and the Safer Guides measure. Finally, participants must report on 4 quarters of data, including 3 self-selected ECQMs, as well as the safe use of opioids concurrent prescribing ECQM. These requirements do ask a lot of health systems to appropriately comply and will need to include adequate EHR product and functionality integrations. These implementations will require the organization to work together to engage and adopt these new capabilities. So one best practice I would first recommend is to incorporate a data governance board, which serves as a central governing body to integrate the perspectives of frontline workers and inform best practices and drive strategy. While health IT implementations require high-level planning on the organization level, ensuring the tool's usability primarily falls on those frontline workers, which is why this is so important. Governance boards can help to increase communication, representation, expectations, adoptions, and outcomes. And they should focus on topics such as data quality and integrity, patient safety, patient privacy and security, and user adoption and utilization. Next, I recommend utilizing effective change management and change control processes. A change control approval process can ensure discussion occurs around proper planning, adoption, training, rollout, and management of the change across the organization. Change management teams can help staff to understand what elements of their day-to-day workflows are changing and expectations as to what will come next. They can highlight benefits of the new technology being adopted relative to staff's clinical roles. And having a change control process can also help ensure decisions and impacts are vetted across dependencies and are agreed upon prior to implementation to ensure a united organizational approach. For training purposes, it is a standard recommended process to incorporate super users who can serve as a system mentor to their aligned units. In addition, instructor-led training organizations should also consider skills assessments at the elbow support, e-learning, and hands-on training. It's also a good idea for hospital leadership to partner with state and/or jurisdictional bodies to inquire about grant or incentive opportunities to implementing these technologies. You can also reach out to federal agencies such as CDC, CMS, HHS, and AMA, or to technology companies to inquire about other incentive opportunities, which I highly recommend doing. Finally, it's important to upkeep tight documentation practices during these projects, so be sure to document deliverables, goals, expectations, timelines, project plans, ONC certification pages, and any auditing data that may be needed for attestation. Overall, I wanted to talk to you today about promoting interoperability, program requirements, and implementation best practices to ensure efficient and optimized processes to comply to promoting interoperability, which fosters many benefits such as increased reimbursements, decreased administrative burden, and improved patient outcomes. But with that being said, I do want to go ahead and open it up for any questions that the group may have for me today. All right, well, if there are no questions, we can go ahead and end for today. Feel free to contact me at the information that is displayed here on your screen if you have any questions or further inquiries. Otherwise, thank you for joining, and I hope you have a great rest of your day.